iliac. Superficial circumflex iliac vessels, guys. So one thing which is like very comfortably that you can remember, because they're all in the roof there, that is why their name has to be having superficial in that one. And one is towards the genitalia, superficial external pudendal, and then towards the gastric epigastric, that is superficial epigastric vessels, and then the iliac region, towards the iliac region, that is superficial circumflex iliac vessels, guys. So all these are the structures present in the roof of the femoral triangle, guys. Now that is the reason why I'm teaching you all these boundaries in a very crystal clear manner, guys. Why? Because in femoral triangle topic, boundaries are extremely important. In the topic of femoral triangle, the boundaries and then the floor, which is formed by 4 muscles, and then the roof, all these structures are extremely important. And after that, when it comes to the contents of femoral triangle, guys, contents are extremely easy actually. Now what will be the content in the femoral triangle? You will be actually having an artery here, and that artery will be obviously femoral artery, and then there will be a vein here. The name of the vein will be femoral vein, and then there will be a nerve here, and the name of the nerve will be femoral nerve only. Along with that, certain lymph nodes are also present in the femoral triangle, guys. So femoral artery, femoral vein, femoral nerve, I think you don't even have to worry about that one. In the femoral triangle, you'll be having femoral artery and vein and the nerve. But you have to worry about the arrangement of that one. Now please look at this diagram here. Now in this diagram, first you are able to appreciate that there is a vein present over here, guys. This is femoral vein over here. Just lateral to femoral vein, there will be femoral artery here. And lateral to the femoral artery, there will be a nerve here, that is your femoral nerve. So vein, artery and the nerve, they are arranged in the form of VAN, VAN, and that too from medial towards the lateral, sir. From the medial towards the lateral. It is in the form of vein, artery and nerve. Perfect. So that is what I just want you to remember here. All these contents are arranged in the form of vein, artery and the nerve, that too from medial towards the lateral. Femoral vein, femoral artery and femoral nerve from medial towards the lateral, guys. That is about the contents. Easier, not that much difficult here. So that is why I want all my students to please concentrate on the boundaries of femoral triangle. Contents though are very much easier. After completing the topic of femoral triangle, inside that femoral triangle, if you observe very carefully here, all the structures present over there are actually covered by a sheath there, and that sheath itself is nothing but your femoral sheath only. So the contents which are present over there, they are covered by femoral sheath. So let us learn about that femoral sheath in detail now. So first of all, what is the shape of the femoral sheath here? Remember, femoral sheath is actually funnel shaped. Femoral sheath is actually funnel shaped, guys. Fine. Now in this funnel shaped femoral sheath, we have to first of all learn about the anterior wall and the posterior wall. So let us try to first of all draw a diagram here. So imagine this one to be your femoral sheath here. And this femoral sheath in turn will have like two walls. One is the anterior wall here, and this one here will be the posterior wall. There will be anterior wall and the posterior wall of the femoral sheath. Now before writing down there what is that anterior wall and the posterior wall made up of, try to understand, guys, where is this femoral sheath exactly located. The anterior wall of the femoral sheath is actually the extension of anterior abdominal wall, one of the fascia in that. In the anterior abdominal wall, we have learned in abdomen topic, there are totally like 8 layers, and out of that 8 layers, layer number 6, that is transversalis fascia. And the transversalis fascia will actually continue down to form the anterior wall of the femoral sheath. So anterior wall is extension of transversalis fascia. Similarly, what about the posterior wall? You can clearly appreciate in the diagram here, the femoral sheath itself is actually located on the iliacus muscle. And that is the reason why the posterior wall is actually the extension of the fascia covering the iliacus muscle, fascia iliaca. Fascia iliaca. You can clearly appreciate there. This muscle here is actually the iliacus muscle, and on that iliacus muscle you have that femoral sheath. That is why posterior wall is nothing but the extension of fascia iliaca. So let us just write down here. What is this anterior wall made up of, guys? Anterior wall is actually extension of fascia transversalis, which is in turn extending from the anterior abdominal wall, whereas the posterior wall is actually the extension of fascia iliaca, the fascia which is actually covering the iliacus muscle, guys. So anterior wall is the extension of fascia transversalis and the posterior wall is the extension of fascia iliaca. Perfectly done. Now once you are done with the anterior wall and the posterior wall of the femoral sheath, let's go inside the femoral sheath, guys. Inside, the femoral sheath is actually in turn divided into 3 compartments. And the names of the compartments will be quite meaningful. The one towards the medial side, the medial compartment, and then the middle one will be the intermediate compartment here, and this will be the lateral compartment. So there will be 3 compartments in the femoral sheath: medial, intermediate, and lateral compartment. Okay. And let us try to understand what are the structures which are going to pass through each and every compartment. That is important, guys, for your exams. Okay. So let's draw this diagram once more in much more clear manner and with full orientation here. So imagine this one to be anterior superior iliac spine, and again this one here to be the pubic tubercle, guys. Somewhere here you'll be actually having your sartorius muscle, and this is adductor longus muscle towards the medial side. Perfect. I hope you're understanding. These are the boundaries of femoral triangle, which I just now taught you a few minutes back. And now where exactly do you have this femoral sheath? You just imagine femoral sheath somewhere over here. So that's your funnel shaped femoral sheath over there, guys. And it is the one which is enclosing the structures present over here. Fine. Now this femoral sheath, in turn, it will be divided into 3 compartments inside. One will be the medial compartment, another one is intermediate compartment, and the lateral compartment. Okay, perfect. But what are the structures passing from here? That is important, guys. So now try to understand here like this. Through the intermediate compartment, first of all, through the intermediate compartment, there will be a femoral vein passing through that one, guys. So femoral vein is the one passing through the intermediate compartment of the femoral sheath. Okay, perfect. And then femoral artery is the one which is going to pass through the lateral compartment of the femoral sheath, sir. That's your femoral artery passing through the lateral compartment of the femoral sheath. And remember, the most important thing, femoral nerve is not at all present inside the sheath. Femoral nerve is not present inside the sheath here, sir. It's actually outside the femoral sheath. So just now we have learned that all these femoral artery, vein and the nerve, they are arranged in the form of van only. Yes, vein, artery and nerve from medial to lateral. But remember, femoral vein is passing through intermediate compartment, femoral artery is passing through lateral compartment, whereas femoral nerve is not at all present inside the femoral sheath. It is like outside the femoral sheath, guys. Outside the femoral sheath, extremely important. Now once you have understood all these things, I want to add like one more detail over here, guys. There is one nerve which is going to pass along with the femoral artery. So along with the femoral artery, there is a nerve passing from here, and this nerve is going to enter inside this lateral compartment. Perfect. That nerve is going to enter inside the lateral compartment. And after that, it is again going to pierce through the anterior wall and come out and supply to the skin covering the femoral triangle. Let me just explain you again. Imagine this is the lateral compartment over here. If this is the lateral compartment, and if this is that nerve, the nerve will first go inside, and after going inside, what is happening? The nerve is piercing through the anterior wall again, and again it is coming out from here. Understanding, my dear friends? So first the nerve is entering inside and then piercing through the anterior wall and then coming outside, guys. Now what is the name of the nerve and what it is supplying to? Remember, this nerve will be the femoral branch of genitofemoral nerve. It is the femoral branch of genitofemoral nerve. Now try to recall, where did we study about the genital branch of genitofemoral nerve? Abdomen topic. And in abdomen topic, we learned about inguinal canal. Inside the inguinal canal, we have got spermatic cord in males. And inside the spermatic cord, we learned about genital branch of genitofemoral nerve. Okay. And here we have the femoral branch of genitofemoral nerve. And so, by the way, it is supplying to what? That was asked in the exam. Remember, this is the one which is supplying to skin over femoral triangle. See, whatever hard work I am doing along with you, drawing this diagram, it is for this reason only. Whatever we have drawn in the black color there, those are nothing but the boundaries of femoral triangle. So, in fact, where are we right now? We are in the femoral triangle only. So, in that femoral triangle, the skin over the femoral triangle will be supplied by. The skin over the femoral triangle will be supplied by femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. Okay. Now, once we are done with all this arrangement over here, better we'll do one thing. First of all, we'll write down the notes till here, then we'll move forward, guys, about the medial compartment. So, the topic that we are learning right now is femoral sheath. And as I told you, the femoral sheath is the one which is actually divided into how many compartments, sir? 3 compartments over here. So, there will be a medial compartment, and then there will be intermediate compartment, and then you have got the lateral compartment. Okay. So, in the femoral sheath, it is divided into like 3 compartments, the medial, intermediate and lateral. Now, you got to learn what is going to pass through all these 3 compartments. Intermediate compartment, it is the one through which femoral vein is going to pass. Lateral compartment is the one from where femoral artery is going to pass. And this femoral artery is along with one more nerve, and that nerve is femoral branch of genitofemoral nerve. Genitofemoral nerve, guys. And do one thing here, guys. Do one thing here. Better you write down below one important note there. One important note there, that femoral nerve, femoral artery, femoral vein and the femoral nerve. Femoral nerve itself is not passing inside the femoral sheath, is outside the femoral sheath. Femoral nerve is outside the femoral sheath. Even that has been asked in many times in the exams, guys. Okay. So, femoral nerve is not lying inside the femoral sheath, it is actually outside the femoral sheath, guys. Perfectly done. Now, if you are perfect with the intermediate compartment and the lateral compartment, I hope already the question is going on in your mind. Then, sir, what about this medial compartment? So, first let's see that in our diagram here, then we'll come back to the notes. What about this medial compartment here now? What is going to pass from here? Now, before learning about the contents of this one, the structures passing from this medial compartment, before learning about those structures, first you do one thing there, guys. Learn the another name of this one. That medial compartment itself is known as the femoral canal. So try to recall what I tell you. In very beginning of this topic here. In the very beginning of the topic, I told you that we are slowly going to go in depth here. First about the femoral triangle. Then inside the triangle there will be a sheath, femoral sheath, and inside the sheath will be actually having the femoral canal. So you can clearly see femoral sheath, 3 compartments. Out of that 3 compartments, the medial. So in the medial compartment, that itself is also known as the femoral canal. Now, what do you have in this femoral canal? You will be actually having the lymph nodes here. The contents of femoral canal will be lymph nodes only, and those lymph nodes are very famously known as lymph nodes of Cloquet. Lymph nodes of Cloquet, or else it is also known as lymph nodes of Rosenmuller. Lymph nodes of Cloquet or Rosenmuller, sir, in the femoral canal. So, femoral canal will consist of the lymph nodes of Cloquet or Rosenmuller. Done. And they are the one which are actually going to drain the lymph from the glans penis in the males, and homologous to that one in the female will be the clitoris. So, the lymph nodes of Cloquet or Rosenmuller, they are going to drain the lymph from the glans penis in the males, and homologous to that in the female will be clitoris, guys. Perfectly done. Now, once you are clear with this one, then what about the femoral ring? Where do you exactly have the femoral ring here? Now, femoral ring will be this one here, guys. The medial compartment will be femoral canal, and that femoral canal above the opening of that, there will be a ring, and that ring is nothing but, that opening is nothing but femoral ring over there, guys. And for your exams, you got to actually learn the boundaries of femoral ring. What will be the boundaries of femoral ring? Anterior, posterior, the medial and the lateral. Now, do one thing here. To make you learn the boundaries of the femoral ring in the easy manner, let me show you one diagram here, guys. Just look at this diagram here. And what you do is, in your mind, you try to imagine, or you try to apply where exactly you have the femoral sheath now. So, remember, the femoral sheath is somewhere here. Okay. Now, if this will be the femoral sheath over there, the medial compartment of the femoral sheath, guys, the medial compartment is nothing but the canal, femoral canal. And that femoral canal, the medial compartment, above there will be opening, and that opening is nothing but, yes, the femoral ring. That is the ring, guys. Now, try to understand from here onwards. What is present anterior to this one here? Anterior to the femoral ring, there will be a ligament, inguinal ligament. Perfect, right? And we have already discussed that inguinal ligament is the one which will be giving an extension on the medial side, and this will be the lacunar ligament. And this lacunar ligament further extension behind this will be the pectineal ligament. Understanding? So, what do you have right in front of the femoral ring? Inguinal ligament. What do you have on the medial side? There will be lacunar ligament. And then what do you have posteriorly? That will be pectineal ligament. And I don't even have to teach you about the lateral aspect. Femoral ring on the lateral side will be actually having femoral vein passing from there, guys. Understanding? So, this diagram makes the things very much easier for you to understand the boundaries of femoral ring, guys. Boundaries of femoral ring. So, the last and final thing in this topic that we have to learn is about femoral ring and the boundaries of the femoral ring, guys. And again, we'll do the same thing to learn the boundaries of femoral ring. Let's draw the diagram of femoral sheath. And this femoral sheath is again divided into 3 compartments. And out of these, the medial compartment, femoral canal. And femoral canal above, there will be a ring. And that ring will be the femoral ring. This femoral ring will actually have one ligament right in the front here. That is inguinal ligament. And inguinal ligament will give an extension towards the medial side. That extension will be the lacunar ligament over here. And this lacunar ligament will actually continue behind. And it is going to continue behind as pectineal ligament. And similarly towards the lateral side, what do you have here? You actually have the femoral vein passing from here. So if you draw a diagram like this, guys, I'm damn sure you will never forget the concept. So instead of learning like paragraph, anterior, posterior every time, best way, draw a diagram like this there, and the things are going to become very much easier. Now, what do you have in front of the femoral ring here? What is this ligament? Inguinal ligament. That is going to form the anterior boundary. Perfect. What is present behind here? That is the extension of inguinal ligament only. That is pectineal ligament. And pectineal ligament is the one which is going to form posterior boundary. Then what is this extension of the inguinal ligament towards the medial side? Lacunar ligament. And lacunar ligament is the one which is going to form the medial boundary. Medial boundary of the sheath here, femoral ring there, guys, sorry. And now the last and final thing is on the lateral side. What do you have here? This one will be the femoral vein, and that is present towards the lateral side of femoral ring. Now you might be thinking like, why is this so much important? Why we are spending a little bit of time over here understanding all these boundaries very clearly, guys? Why? Because yes, there is a connection between anatomy and surgery over here. This is the place, the femoral canal, that is the place where most commonly hernia will occur, and that hernia will be the femoral hernia, which is more common in females. And when femoral hernia will occur, when the surgeon is trying to repair that femoral hernia, yes, these boundaries has to be known there, and one of the boundary has to be cut so as to make it easy to repair the femoral hernia over there, guys. Okay, so that's why you have to be like very clear about the boundaries, and that is crystal clear in our diagram over here, guys. So that completes the entire one big concept here of femoral triangle. Inside the femoral triangle, there will be femoral sheath. Inside the femoral sheath, there will be femoral canal, and above the canal, the opening will be the femoral ring over there, guys. So that completes the entire concept at once.